The benefits of large group dental practices include having potential help from the corporate offices, which help in hiring and front office and back office protocols. This could lead to less stress for a practitioner because they don't have to manage a practice themselves. It could also be beneficial to new graduates because there's no cost of startup and it helps place people in practice. The disadvantages of large group corporate-owned practices are many, including the practitioner loses autonomy. So the practitioner, the dentist, has to abide by corporate policy and structure, and also the pressures of having a corporate office dictate how they should practice dentistry. The other disadvantages are the dentist can work for years and not have an equity position in that practice. And then there's also the flexibility and the autonomy of owning your own business. So you have a corporate boss, so to speak, and that's a big disadvantage in dentistry. You'd like to think that if you were working hard and establishing a practice, that it was your practice completely. Large group corporate-owned practices do put pressure on private practices like mine, in that there's a corporate presence and they have a budget for advertising, and they have professionals that can market to the public, and they can also offer services cheaper because they by and large have new graduates who will work for a lot less money come in and work for them. Recent graduates from dental school are migrating towards large group practices for several reasons. The first is they have such a tremendous amount of debt after dental school that they need to find a job immediately to help service their debt. And these are the jobs that are available. Unfortunately, with the economy shrinking and with the financial meltdown that we had, most established dentists have had two things happen to them economically. The first is their net worth has gone down because the value in their homes has decreased, their pension plans, their value typically if it was in stocks and bonds has decreased, and that's put pressure on them. Also, their businesses are slower because times are a little more difficult with the recession, so they're less inclined to do two things. The first is they're less inclined to sell their practice because they need the income because their net worth has gone down. Secondly, they're less inclined to bring in a young dentist as an associate because their practices are slower and they, quite frankly, need to have the work for themselves. So it's a much more difficult atmosphere these days for young graduates. Also, large corporate dental practices are the one area of dentistry that's expanding. So when a young dentist graduates and they're looking for an opportunity just to service their debt, that's where they're forced to go a lot of times for that first job. It's not necessarily what they want to do, but there's a lack of quality positions in private practice available right now. I do believe that large group practices will continue to expand. It's a very profitable business model, especially for the corporate owners. It's not necessarily advantageous from an economic perspective to the dentist, but I think it's a business model that's here to stay. There's a lot of private equity money behind this. There's a lot of really smart MBA types that have figured out a way to commoditize dentistry and really to commoditize dentists. And so I think that we're going to see a lot of this. However, I believe that there still is going to be a place for a good private practitioner. I think you'll find that there becomes a bigger divide between these two types. It's going to be more difficult for fee-for-service private practitioners, but there's always a niche for people who are really excellent at what they do, and there's certainly a percentage of the population that want the very best and that are comfortable, going to a private practice. So I believe there's going to be room for both, and there'll be expansion of both. And the good news is dentistry just continues to get better. So the technology is better, the techniques are better. So as time goes on, people are going to really benefit from getting a better product and a better service, whether it's from a large group practice or from a private practitioner.